The one that really sticks out was this young girl. She had come to see me. She was about a week out of, the hospital. And the reason she was there is because her sugars were in the 400s. I heard a baby in the background, and I had started to say to her, were you, a gestational diabetic? And she says, yes to me. But she's like, I did a little bit of insulin, like here and there, nothing too crazy. And then I said to her, did you go to your 6-week follow-up? And then her answer was no. When we tested her A1C was at 13. And it was something that I really it struck a chord with me just because of the fact that I had also at some point, been a gestational diabetic. And I could hear that I saw that she was young. She had this new baby. So of course it's, trying to help her out as much as I could. But we were actually, for instance, able to start her on insulin. Then of course, the concern became, do you know how to give yourself, insulin? Because a lot of people don't. And so she was like, well, not really. And I was like, okay, not a problem. So I set her up with one of our case managers who did a visit with her as well, was able to successfully teach her how to use the insulin. We did everything the same day. And then I gave her a follow-up call, the next day to kind of see how's everything going. Are you doing okay? She was like, no, they showed me how to use it. We went through some examples. I felt comfortable using it at home. About 2 weeks later, she came back and I was like, okay, how are the sugars? And she's like, well, my, fasting, it's down to like 90, which used to be 200. My before meals, those have gotten, a lot better. They're in the 130s now. So I'm like, okay, great. It was really sort of like a team effort, getting the case managers involved, getting chronic care management to, teach her, about the nutrition side. And, now she's doing great. Her sugars, are well controlled. Her A1C is less than 7. So as a doctor, I'm like, I couldn't ask for more.